Hi, my name is Ryan Lavi, and I'm doing my presentation on Thoid cerebral palsy, also known as dyskinetic cerebral palsy. To have this dyskinetic cerebral palsy, this is a movement disorder caused by damage to the developing brain. It has involuntary slow rhythmic movement of the fingers, hands, toes, and feet. There are a bunch of signs and symptoms. These have to do with the severity of and the location of the movement issues. Children with cerebral palsy differ between hypertonia and hypotonia. Hyper is usually high muscle tone, causing stiffness and tension in the muscles. Hypertonia is a low muscle tone, which causes floppiness in the muscles. These two defects are what causes cerebral palsy. The most common symptoms are involuntary movement of the muscles, tremors, poor posture, unsteadiness, twisting of the torso, slow rhythmic movements, abrupt movements, grimacing, or drooling. The symptoms also depend on whether the damage was solely to the basal ganglia or if the cerebellum and basal ganglia were damaged. If both areas are damaged, this will likely cause problems with balance and coordination as well. Parents usually find out if their child has dyskinetic cerebral palsy, usually notice the signs of this when they're 9 months or older. In young children, involuntary movement can be cause of a delay in their development. Cerebral palsy may be present in children with kids who don't kick legs, seems stiff or rigid, seems limp, doesn't hold up their heads at 3 months old, doesn't reach for objects, doesn't smile by 3 months old, doesn't roll over. There are many causes and effects of cerebral palsy. This is based upon what part of the brain is damaged. Dyskinetic cerebral palsy is caused by damage to the basal ganglia or the cerebellum. The basal ganglia is a group of nuclei in the brain that is responsible for coordinating voluntary movements. This also has to do with thinking and learning of the individual. Damage to it affects the motor function development and causes involuntary movement. The cerebellum is a part of the brain that is responsible for regulating coordination and precision of the movements, both which is very important to fine motor skills and balance. Damaging the cerebellum is harder for one to have balance and coordination. The cerebellum is also an important part of the cognitive functions such as communication and attention. Damage to either or of the cerebellum or basal ganglia can be caused by infections such as meningitis, trauma to the developing brain, or lack of oxygen to the developing brain. Risk factors such as premature birth, severe infantile jaundice, and blood clotting in the placenta increases one's chance of getting dyskinetic cerebral palsy. There are many treatments for dyskinetic cerebral palsy. One that helps the children with this disorder is making them more independent and confident in their abilities. PT and speech therapy improve existing symptoms will also prevent any problems later in life. Physical therapy deals with strength training exercises, resistance bands, and machines to help improve low muscle tone. PTs also try to help overcome any sensory impairments such as touch and perception that makes movements for one difficult. The PT's main goal is to improve overall mobility. This inclines exercises the face and tongue muscles to help stop drooling. It also helps posture or keep the body steady and upright so they don't have problems later in life. The occupational therapist is used to enhance the child's ability to play and learn without help. His or her main job is to help the child make everyday tasks like grabbing objects, writing, or using assistive mobility devices easier with the person with the disorder. They also stretch with weights, resistance equipment, and putting functional and playful activities to keep the person interested. They also allow children to form relationships and respond to demands of daily life, which increase mobility and confidence. Other treatments are speaking, eating, or breathing is a challenge for the people with cerebral palsy. Speech therapy is used to ease these problems as well as increase the language of the individual and building his vocabulary, articulation, and breathing control. After working with the speech therapist for a while, people with cerebral palsy often begin to have more control of their face and the tongue muscles. It can also make daily tasks for them easier by increasing independence for the individual with the disorder. Medication can also help this type of cerebral palsy in many ways. They used to treat secondary conditions that result from the developmental brain damage. An example of this would be anticonvulsants. This is used to reduce the seizures and over-the-counter acid reflux medications that are prescribed for children with weak gastroesophageal muscles. Ritalin and other medications treat ADHD, which is diagnosed into up to 20% of children with CP. Medications to control drooling and incontinence are also used for those with cerebral palsy. Surgery, mainly for people with high muscle tone, is used to correct and prevent issues with the joints, muscles, and tendons by correctly aligning parts of the body to foster health growth. Prognosis. The life expectancy for someone with CP is 30 to 70 years of age, depending on the severity of the condition. Child with mild case of CP usually lives longer than child with mobility and intellectual limitations. Children who respond well to physical and occupational therapy have no intellectual development problems and can function with little or no assistance, live longer lives than those with severe disability caused by CP. A life expectancy is also determined by the quality of treatment that a child with CP receives. Other factors that determine life expectancy are respiratory disorder and related issues. Three major educational considerations are public school, because it has a lot of benefits for people with cerebral palsy. It's a cost-free education. It prepares them for independence and aid with social skills. It has you could pick between a class with normal and special ed kids or just special ed kids. And private school is another one. There's two types. There's conventional private school and special educational centers. The conventional private school is a religious regular studies with small groups compared to public schools. But the special educational center is focused on child with disability with high-tech equipment and high instructors that are trained for this. And the last one is homeschooling, where they have comfort in learning in one's home, especially with limited mobility, bad sleeping patterns, and short attention span.